be able to help people when they, go on this really difficult journey is really a privilege for me. I see people who come to me who, have this new diagnosis that is really kind of terrifying and scary. By the time that they come to me, they're dealing with this unexpected diagnosis. They have a lot of information that they're dealing with. They're wondering how this diagnosis is going to change their life from this point on and how uncertain the future is. And so this is a cancer journey that is difficult, and I feel very privileged to be in a place where I can help and support these people going forward. And so, to be able to get them to a place where they, have a better quality of life, they have a longer life, and getting them back to what they can do with their families without, prior to all of this happening is something that, really gets me up and going in the morning. So when someone comes to me for the first time, I try to understand who they are. I try to learn a little bit about what kind of person they are, what values they have, and what's important to them. And then I try to educate them on what their disease is, and usually what we try to do in this situation to sort of see what fits them and fits their goals and what their needs are. And that's something that we talk at the first appointment, but we also talk every single time they come back. There is no immediate commitment to a treatment plan starting, from the get-go, and it's a conversation that we continue to have. Usually, we get people on a treatment plan or treatment regimen pretty fast. But if anything changes, if they change their mind, if something about their disease changes, or we find a new piece of information, we always try to, go back and have that discussion again to see what is really best for them. I remember taking care of a patient that I met for the first time last year. He is someone that, don't really like to see doctors, prides himself on, being able to take care of himself and take care of his family. Specifically, he is a sole provider for a grandchild. And so he was telling me stories about his grandchild, and he was very anxious and, very nervous. He was asking, how is this going to change what I do on a day-to-day basis? Is this going to affect my ability to take care of my grandchild? Is this going to affect my ability to do my job? How is my life going to change from this point on? We had multiple conversations before we were able to settle down on a treatment plan. And, every time he had side effects from the treatment plan, we would talk about, what this means, what are the risks and benefits, and is the risk worth the benefits? And ultimately, he stuck with it. And I'm really happy to say that his first restaging scan, things look better. It's working, and I was able to pick up the phone and tell him that, all the work that he's put into this is working, and that, we're going to get him back to where he was. My primary sort of draw to cancer is the research I was doing. So I was doing my PhD in a cancer lab, and I thought, this is so cool. I have no idea why a normal cell would turn to a cancer cell and basically turn rogue and turn to this thing that, can kill people. And so I wanted to learn more about that process and, how can we address that process? And so that took me to many places, but now it took me to the lab of Dr. Todd Feniger, who is one of our top cellular therapists, who does a lot of incredible work in trying to reprogram the immune system in a way that it would kill and target cancer cells. So a lot of the innovations in skin cancer is really activating and waking up the immune system. We try to get the body's own cells to fight the cancer, and we find that's really effective. And for skin cancers, it's the best and the most potent treatments that we have. My role in the lab and what I'm trying to do in the lab is try to get these natural killer cells to kill melanoma cells. It's really cool, but we can see these natural killer cells kill melanoma cells in a petri dish and also in mice. And so we're trying to bring that to the clinic, and hopefully we can make a new therapy with these natural killer cells to treat melanoma patients. We're having treatments translate from the laboratory to the clinic, and things like immunotherapies that have completely changed what we're doing for cancer patients. It's so fascinating to see that, and I really want to be part of that.